the pleasure to be here today with Dr. Thomas. Dr. Thomas, how are you?
I'm doing fine, thank you.
And I also have the honor to be one of his patients.
That's right.
One of the patients that comes afraid, very nervous, but coming here to your office makes a big difference. Why is that?
Well, that's a good question, and there are many patients out there who are very nervous and they are scared to come to the dentist office, although they know that the tooth is hurting, they need work to be done. But this fear of going to the office is holding them back. That's natural. There is nothing that can be done by themselves. Now, here is what we do differently for them. We bring them in on the first visit, we try to talk to them and ask them to fill out a few paperwork. And through each question they answer on the paperwork, we design a treatment plan that is special to that patient. Now, that treatment may not be the good one for another patient. Now, when I look at each patient, based on what the questions they answer, we divide the mouth into 3-4 areas. One is the smile, one is the gum, one is the cavities, and we start to build the foundation, which is the gum first. So once we take care of the gum, we treat the cavities, then we focus on the gum. Now, when we talk about the fear, we use different laughing gas, which makes them very relaxed, and also we use some sedations. We ask the patient to take some pills, which helps them to take away the fear. This way the patient feels very comfortable, and from start to finish we make them comfortable. Whether it is a 6 months routine cleaning or an extreme makeover or a root canal or an extraction. Most of my patients, I treat them like my family. So we don't hurt them. All we say is, come in, we will design a treatment plan for you. From start to finish, we will take care of you.
And I know you will take care of it because I'm one of your patients.
Yes.
And the day that you did the root canal for me, I didn't need any of the gas or anything. Your
Right.
gentle hands were so amazing. When
Right.
you were done and you told me, Trisha, I'm done, I
Right.
was impressed because I didn't
Right.
feel any pain or I wasn't scared at all. I was very
Right.
relaxed.
That's one of the common thing I hear about root canals. When patients come in root canal, they say, oh, that hurts. Well, how do you know? They never had a root canal, but they hear out in the community. They search on the wrong information on the YouTube. There are some patients may post there, your root canal hurts. Well, it hurts, but if it's done properly, planned properly, root canals will not hurt. 99% time, it does not hurt. That's what we are all about. Properly planning, separating that patient from other patients, and focusing on one patient at a time, so that the time allocated is only for that patient. This way we don't have to rush on that patient, take care of that patient that needs to be completed within that allotted time. The patient leaves the office happily, calls back and says, I'm happy too.
And this is the key because I noticed that you don't overbook your patients, so you dedicate the exact time that you need for each of them.
Exactly. Someone told me a long time back, if you had to travel to Dallas, you need minimum 3 to 4 hours. But can you reach there in 1 hour? Yes, you can, but you would create a lot of problems on the way. Your car won't be the same car.
Yes, and
exactly
it's what
the same
happens
thing.
with the
Exactly.
dental office. They focus in numbers,
Right.
not in patients, not in good service.
Right. Yeah, there is a way to take care of certain patients. If we need to allocate certain time for each patient, and it can be handled better.
You're right. Dr. Thomas, is a very common sensitivity in the teeth.
Right.
How can we prevent that?
Well, it starts with first coming to the office. Sensitivity is, why is the sensitivity? It can be due to many different reasons. One of the common reason is, that I see a lot is, patients have no cavity, they go to the dentist and they say they have sensitivity. The gum is supposed to be like a blanket for the roots. The crown, which is the white part of the teeth, has enamel covering it. Now, when the gum starts receding what I mean is, it starts going down and the roots are exposed. So you don't have a blanket over the roots. So what happens is, all that temperature, cold water, ice, whatever you eat, temperature-wise, sensitivity hits the root, and the root has has no enamel covering on the root, so it becomes very sensitive. Now, what do we do in such patients? We evaluate it. Either we do a gum grafting, or there are some toothpastes that is available freely out in there that can be used to brush with that toothpaste, and the sensitivity eventually goes away. Now, if there is something more to be done, we have other treatment options that needs to be done to remove the sensitivity also. That's the reason for sensitivity. Right.
And what is the most common problems that you treat here at your clinic?
We get a variety of diseases in the mouth. Some of the diseases have no pain. But when I point it out to the patient and they say, I knew about it because that could be the reason why this is causing. For example, it could be just like the tire of the car, it's wearing out. But the patient thinks that's normal because he's chewing on it, he's eating on it, teeth is wearing out. And the teeth is getting smaller and smaller. 5 years ago, his teeth was longer. But after 5 years, the teeth is only half the size. What is causing it? It's a joint problem leading to bite problems. So the teeth, top and bottom, is grinding against each other and is causing to decrease in height and length. So we do extreme makeover for that to replace the missing part and to bring the teeth back to normal function and form. This way he can bite on it, his teeth will last longer on that one. That's one of the common things that we see a lot. Then we have cavities. Cavities, when it's small, it doesn't cause much problem, but the longer they wait, these cavities the bacteria starts eating away the teeth structure and gets closer to the nerve. By then, it's almost very painful and they need a root canal.
Yes, that's a problem because we don't go to the dentist for a small cavity and it turns into a root canal.
Root canal. Then it becomes a root canal. Now, if root canal is not treated properly or is not done at the right time, what happens, the pain goes away and the patient thinks, oh, everything is fine now. But no, actually there will be a period of time, sometimes the pain goes away, but the next time the pain comes back and you go to the dentist, nothing can be done. The tooth needs to be pulled.
After getting a root canal, they have to pull the tooth.
Sometimes, yes. Now, most of what I was trying to say was, if you don't get the root canal done at the right time, it can lead to loss of tooth. And if you lose a teeth, one by one they may lose it and there will be a problem chewing and smiling. So that's some of the most common problems. Then
so we have to visit a dentist's office here with Dr. Thomas every 6 months.
Every 6 months. Every 6 months we look at their mouth, we look at the gums, we kind of detect any diseases that is in the initial stages, and then we decide with the patient who is in risk of this problem getting into a bigger problem. Not every patient needs to be restored of the small problem that is starting, like a small cavity. If it's only a small one, we can wait on it. In 6 months we check it. If it's not getting bigger, we can wait on those small cavities. But certain patients, their risk of developing cavities, if we see that it is very high, we immediately tell the patient about it. It needs to be filled. The other problem that we see more is the gum problems.
Yes, I was going to ask about that.
Yeah. Gum problems, some of the signs is just bleeding only. Sometimes bleeding only. Some patients have bad breath. Some patients have no complaints at all. The complaint starts when the tooth becomes loose. By then, nothing can be done. So it needs to be addressed way before it became loose. Why the tooth is loose is because the foundation, which is the bone holding the teeth, is all gone because the bacteria under the gum destroyed all the foundation, that's the bone. So when the bone is gone, tooth is gone too. Now the problem is now how can we put a teeth back there? That's when implants, that is very helpful. But in order to do the implants, we need good bone there too.
Yes.
So it all starts with, we don't want implants in patients unless there is good bone there. So bone is very important to maintain the bone level by doing a good oral hygiene, going to the dentist in time. We can preserve the bone and detect any cavities and restore them so that we don't want them to lose any teeth. That's one of the main things that we find. In addition to that, we may find some of the diseases that is very dangerous also, like oral cancer. Some of the patients have no cavities, no gum problem, but we may still find some problems in their gums that needs to be addressed also. So that's very important. During the routine 6 months cleaning, we do an oral cancer screening for that also.
It is a method to prevent besides
detect
the
also.
6 months.
Right, yeah. So besides the 6 months, in addition to that, we do the oral cancer screening also. Right.
Dr. Thomas, what do you recommend to a patient that comes to your practice with missing teeth?
Missing teeth, patients can be treated very easily. Depends on how many teeth they are missing in many different ways. That treatment can vary with a simple bridge. If it is replacing one teeth, yes, bridge is something that is very common and that's a traditional way of treating a missing teeth. Bridge means it's supported by the adjacent teeth and it's cemented permanently. It should last 5 or more years minimum. Now, when it comes to more than missing one teeth, it goes into more like a complete set of teeth that has to be replaced. It becomes a denture. Now, dentures are treated differently. Denture sits on the top of the gum. It's not very comfortable. Most patients are complaining. They can't eat properly, they can't talk properly because the denture is wobbling. For example, I have one denture in my hand here. It can be made comfortably, but no patients are very happy with it. They have to get a balance of it, but it still moves. In that case, what I do for them is secure this denture to the bone by placing some implants there. It can be minimum 2 implants. It won't be very comfortable, but that's a big advantage to have at least 2 implants there, or more than 4 implants if we place on the lower. Then we put a snap-on clips on the denture that matches with the implant, and we press on it.
Okay.
It clicks onto it. It stays more secure. Now their life is more improved because the denture doesn't wobble in the mouth. They can eat comfortably, they can talk comfortably. Anytime if they want to take it out, they can take it out, depend on the type of the denture and the implant we plant. Some of them we cannot take it out. It's more like permanently screwed. The denture is screwed with screws to the implant. They cannot take it out. Now some of them are snap-on. That's the way we treat the patients with missing teeth. Whether it's one teeth or more than one teeth, we have the treatment for those patients.
And how long a denture will last?
The dental implant would last for a long time. When I say a long time, it all starts with proper planning. On a patient who is healthy and there is good bone there, an implant should last a lifetime. Now, there are some patients in whom implants doesn't last very long. Such patients needs to be properly planned, and we need to correct those bone deficiency and then place the implant. It still should last a lifetime. So I would say it varies, depends on the patients. And to properly give an answer, I need to see the patient. I need to see how much volume of bone is remaining in order to give that answer. Most of the time, when we do something like that, implant should last a long time.
So the best option is to come and visit the dentist every 6 months and take good care of our teeth, right?
Yeah. The moment the patient walks out of here, I tell them, no, your 6 months appointment is very important. You need to come back so we can catch any kind of initial stages of problems, catch it and treat it in the beginning itself, so it doesn't go into more problems later. That's why a 6 months routine care is important. Say we place an implant and we don't have to do anything, but we need to see them routinely for routine checkup and care for that procedure that was done. That would extend the life of it. If that patient doesn't come back, never goes back to the dentist, the maintenance is not done. Such procedures, whether it's implant or anything, it won't last in their mouth.
So somebody who needs dentures, it's someone they haven't done the proper care of their own teeth.
Yes, yeah. So when we remove all the teeth and put a denture, even a denture with no implants, many patients say, why do I have to go to the dentist? Now it's a denture. They still need to be seen every year because the bone shrinks and the denture will not have the same fit this year compared to the last year, because the bone, when the teeth is taken out, it decreases in size.
Okay.
So the inside layer of the denture doesn't match with the bone, because the bone shrinks, denture doesn't match with it. So it needs to be every year checked for fit and form. What I mean by that is whether it is loose, depending on the looseness, and denture can be easily relined by sending it to the lab in few days. It comes back, the fit is improved on that one.
Very good. Dr. Thomas, how can you improve someone's smile?
Well, we start with filling out the forms there. Then I sit with the patient and then I talk to them. I just talk to them not about how to improve their smile. We just talk about casually. And each time we are talking to them, I'm observing the way they smile, the way how much tooth is showing. And I get a lot of information from that. Then I ask them about how do you like to improve your smile. Some of them tell me I want more whiter teeth. Or they may put it in the forms that we ask them to fill it out. Then I combine my observation, what I talked when I was talking to them, with what they told me, and we put together a treatment plan for them. Some patients, all they need is to do a simple whitening. We do offer two types of whitening. One is zoom whitening, and other one is core whitening. Now, what's the difference between these two? They basically does change the color of the teeth, but whitening, there is a lot of myth out there about whitening. There is a difference between whitening and bleaching. What whitening is, it just removes the surface stains and causes some type of color change, which is temporary. That is whitening. What we do with core whitening is basically bleaching. Bleaching the teeth is the bleach gets into the teeth and removes all the surface stains, and it penetrates into the teeth and removes the underlying color of the teeth. So this way, when the treatment is done with the core whitening, the color of the teeth changes from inside to the outside.
Okay.
Versus whitening, on the other hand, is only an outside color change, which is
And it's temporary.
It's temporary. American Dental Association website also explains about the differences between whitening and bleaching. So with the core whitening, it's a little bit more detailed type of whitening. We make a custom tray for the patient, and the patient wears the tray for 2 weeks, and in 2 weeks the patient comes back, their teeth is already whiter. Then again we do another 1 hour whitening in the office, combined with the 2 weeks of home whitening, and the office 1 hour whitening makes a big difference, which is more permanent. When I say permanent, will the color go back to the original color? Never. It never goes back to the original color if the patient maintains it. Maintenance is to avoid certain stain causing
Coffee, wine.
red wine. It needs to be avoided, not permanently. It can be taken, but not during the session of whitening procedure. Once it's completed, they can have whatever they want, but they need to do the maintenance whitening. Along with the core whitening we give them some trays to maintain it. That's how we can maintain the new brighter color, and that will look great on their patient face. Now some patients may need more than whitening because they already have some dark color around the gum line from the previous crowns. That crown needs to be replaced. That crown may be a metal crown. We need to do a non-metal crown. Some patients may need braces because their teeth are not properly aligned.
Like I did.
So in those patients, we need to put them through braces to move the teeth to the new position and align the teeth. Then maybe do some crowns if they need it, or put some veneers on the teeth and make their smile better. So there are many ways we can improve their smile, or even with a simple white filling. With a white filling, we can also contour their teeth. What I mean by that is, instead of placing veneer for closing the gap between two teeth, we can also use some of the white filling material to close that gap. Now, is that as good as the veneer or the crown? No, it is not, but it is very affordable. That way too, we can improve this patient's smile immediately with that type of procedure, and later on patient can come back and put 2 veneers on it also. That's why we can close the gap between the teeth, which is a simple procedure also.
But it's more recommended to close the gaps is the braces.
There is, yes, with the braces it can be closed to. Now in some cases with the braces, patient don't want to go through the braces for a long time. That's when the crowns, fillings, all that can be used to close the gap also, because braces takes a long time. Now certain patients, they have to get braces done because the teeth is not properly placed in the mouth. Such patients, there is no other option without doing the braces to close the gap or improve their smile. Yes.
Thank you, Dr. Thomas, for all this valuable information. And also, Doctor, why don't you tell us how many awards and how many certifications you have achieved during your career?
Well, when I first graduated from dental school, I thought I knew everything. Well, the school, every dentist who graduated from school, we are all the same. But some of us go beyond that to take extra training. I had the privilege to get training under some of the renowned dentists out in this country in implant and in smile makeovers. So I have certificates in implants from some of the famous doctors, and also in prosthetics, and I was well trained by some of the great doctors and had the privilege of those to sit at their feet and learn from them also.
That's very well. Thank you so much for all that information. And if you need a dentist that is going to take care of you very well, you need to come and visit the office of Dr. Thomas.
Hello, I'm Dr. Thomas. On behalf of my practice here, I would like you to welcome as a new patient to my practice here in Sugar Land, Cornerstone Dentistry. From the moment you make the phone call and make the appointment, we will make sure that everything is done properly so that you will leave our practice with the good remarks. You can either fill your forms online on my website www.mysugarlanddentist.com, or you can come to our practice and fill it before your appointment on the same day. Now once you fill your forms, we'll take the necessary x-rays and talk to you about the problems you have. Once the problems are found out, we sit with you and we cater a treatment plan for you that is needed, affordable, and prioritize what needs to be done first and what needs to be done next. Based on that, either we start the treatment on the same day, depending on your comfort level, or we bring the patient back on another day to do the necessary treatment. When you leave my practice, we want you to be happy so that you would refer other patients to our practice too. Remember, Cornerstone Dentistry is always about patients and family oriented. Thank you.